This is Dr. Jerry Hesch from Hesch Institute. I'm a physical therapist, practice in Aurora, Colorado. And this is my client, Doug, who is very active and has had some knee pain for a couple of years on the left. And he did go to a renowned orthopedic clinic and had an MRI. And they basically said his knee was fine, some mild degenerative changes that we all get with aging. And so no specific intervention was recommended. And he feels like his patella does not track well, so I'm going to let him describe that.
The knee is historically been sore over the last 12 to 24 months, especially during exercise or post-exercise. And I believe it's because that kneecap is not tracking correctly. It seems to get pulled to the side, and so looking for relief of that.
Very good. And they also captured that on film when you were on a bike fitting. Tell us about that.
That's correct. So recently had a bike fitting to dial in the bike. It's a road bike, and from the head-on camera shot you could see that this knee that I've been struggling with bowed out, that the whatever was happening, shortening of the tendons and muscles or so forth, would not let it track just in line. It was pulling out to the side, and fairly significant at first. Then we made some adjustments to the bike and it was much better, but you could still see that it was not tracking straight.
Yeah, very good, very good. Subtle difference in the patellar mobility. So on your right knee, I can easily translate the patella left and right. Mm-hmm. And on this left knee, feel that resistance?
Yeah.
So there's a little bit of difference. And when I squeeze underneath and try and lift your kneecap towards the ceiling, the right patella lifts. When I do that on this side, it doesn't lift.
Nothing.
Okay? Now the other thing I noted is that this thigh looks more posterior, the lower thigh, than the right one. And I also noticed that when I take up the slack, pushing through the right knee, I can take up some movement to a natural stop. That's called taking up the slack. And then when I impart a spring, I can get additional movement through that joint so it springs forward and then it recoils back. On this side, the slack gets taken up very quickly. And there's a natural stop point, and now I'm trying to spring it, and it is blocked. I cannot induce any forward mobility in the left knee using additional force. Can you tell how much force I'm using?
I can't, but I can tell you that I can certainly tell the difference in those two moves in this leg. There is spring.
Okay.
One, there's a greater movement initially, and then there is a recoil as you described.
Yep. Yep.
And on the other leg, it goes there's not much movement, and then it stops.
Perfect. So I'm going to treat your left knee, and I'm basically going to glide this left distal femur forward, and I'm going to block the tibia while I do that. I'm going to do that for 5 minutes. So it looks like this. I thread my arm underneath it, and I lift up with my forearm and push down on the lower leg. And I'm going to stay there for 5 minutes. And after that, we'll retest those movements and see how you feel. Thank you.